What if the cough you've been ignoring is a whisper from your body, signaling something far more serious? Join us as we unravel the subtle yet critical early warning signs of lung cancer. We'll dissect each symptom, offering insights and real-life examples to help you stay one step ahead in recognizing this deadly disease. Stick around to discover how catching these signs early can not only change your life, but potentially save it. Understanding these symptoms could be your first step towards timely intervention.
Lung cancer is the second most common cancer worldwide. More people die of lung cancer.
Persistent cough. A persistent cough, particularly in individuals who smoke, is a significant red flag in the context of lung cancer. Unlike a cough associated with a common cold,
What sets it apart from other coughs is how long it lasts. Most coughs caused by other conditions,
which typically resolves within a week or two, a persistent cough lingers. It's crucial to understand that most lung cancers do not cause any symptoms until they have spread, but a persistent cough can be an early sign. In a study published in the European Respiratory Journal, researchers found that a chronic cough was present in about half of lung cancer patients at diagnosis. This statistic underlines the importance of not dismissing a persistent cough, especially if you are a smoker, as it could be an early warning sign of lung cancer. Changes in cough. The nature of a cough can often serve as a vital indicator in diagnosing lung conditions, including lung cancer. A noticeable change in the sound of a cough, such as it becoming deeper, hoarser, or producing an unusual amount of mucus, should raise concerns. These changes can indicate that the lung tissue or airways are affected in a way that is not typical of a common cold or bronchitis. One of the most alarming developments in a cough is the presence of blood, a condition known medically as hemoptysis. Coughing up even small amounts of blood can be a significant warning sign of lung cancer. The American Cancer Society notes that approximately 1 in 4 lung cancer patients report experiencing hemoptysis. This symptom usually arises when lung tumors block an airway or invade nearby blood vessels, causing bleeding.
Vasodilation is the widening of the blood vessels. This increases blood flow.
The presence of blood in cough should never be overlooked, as it is a clear signal from the body that something is amiss, and it necessitates immediate medical evaluation. Repeated respiratory infections. Another critical symptom to be aware of is the frequency of respiratory infections, such as bronchitis and pneumonia. It's not uncommon for individuals with lung cancer to suffer from these infections repeatedly. The reason behind this pattern is that lung tumors can cause obstruction in the airways. This obstruction leads to a buildup of secretions in the lungs, creating an environment conducive to infections. A significant study published in the Journal of Thoracic Oncology has highlighted a strong association between recurrent respiratory infections and lung cancer. This finding is particularly relevant for individuals who have a history of smoking.
Most coronary artery disease is preventable, says Dr. Hayes.
If you're smoking, stop.
Or have been exposed to lung irritants over a prolonged period. Smoking and exposure to certain chemicals or dust can damage the lungs, making them more susceptible to both infections and cancer. Repeated respiratory infections, especially when they occur without other typical causes like a cold or flu, should be a red flag. In such cases, these infections could be symptomatic of a more serious
Observation is a non-surgical approach in which we allow the stone to pass on its own. The smaller the stone,
underlying condition like lung cancer. It's crucial for individuals experiencing frequent respiratory infections, particularly those with risk factors for lung cancer, to seek a thorough medical evaluation. Early detection of lung cancer can significantly improve the chances of successful treatment and can be life-saving. Breathing changes and wheezing. Breathing changes and wheezing are significant symptoms that can be associated with lung cancer. These symptoms often manifest when lung cancer blocks or narrows an airway, or if fluid from a lung tumor builds up in the chest. When airways become constricted, blocked, or inflamed, the lungs may produce a wheezing or whistling sound during breathing. It's important to differentiate this from asthma.
Asthma is a chronic condition that affects the airways in the lungs. The airways are
a common condition that also causes wheezing. Unlike asthma, which is often triggered by external factors like allergens and is usually reversible with medication, wheezing due to lung cancer does not improve with typical asthma treatments and is often persistent. A study published in the American Journal of Respiratory and Critical Care Medicine reported that wheezing associated with lung cancer is often misdiagnosed as asthma or chronic obstructive pulmonary disease, COPD. This misdiagnosis can delay the correct diagnosis and treatment of lung cancer. Therefore, It's crucial for individuals, especially those with risk factors like smoking or a family history of lung cancer, to get a thorough evaluation if they experience unexplained wheezing or shortness of breath. Changes in voice. Changes in voice, such as hoarseness, can also be an indicator of lung cancer. This symptom occurs when a lung tumor affects the nerve that controls the larynx or voice box.
Voice and speech are not the same. An infant crying or an adult laughing.
The recurrent laryngeal nerve, which is responsible for controlling the vocal cords, can be compressed or invaded by a tumor, leading to voice changes. Hoarseness related to lung cancer is different from that caused by a common cold or other benign conditions. It is typically persistent and does not improve with usual care like rest or over-the-counter remedies. A study in the journal Lung Cancer highlighted that hoarseness is a frequently overlooked symptom of lung cancer. The study emphasized the importance of considering lung cancer as a differential diagnosis in patients presenting with persistent hoarseness, especially in the presence of other risk factors. It's essential for individuals experiencing persistent hoarseness or changes in their voice to seek medical evaluation, as early detection of lung cancer can significantly impact treatment outcomes. Unexplained weight loss. Unexplained weight loss is a significant symptom often associated with lung cancer.
Sudden weight loss in a young person may make him happy.
And various other types of cancer. This weight loss occurs without a change in diet or exercise routine and can be quite dramatic. In lung cancer, this symptom is thought to arise due to the cancer cells consuming a large amount of the body's energy. Additionally, substances released by the tumor can also change the way the body uses food energy, further contributing to weight loss. Scientific studies have shown that unexplained weight loss is a common symptom in cancer patients. According to the American Cancer Society, as many as 40% of cancer patients report unexplained weight loss at the time of diagnosis, and up to 80% of advanced cancer patients experience weight loss and cachexia. This symptom is particularly concerning in lung cancer, as it often indicates an advanced stage of the disease. Therefore, any instance of unexplained weight loss warrants a thorough medical evaluation to rule out lung cancer, especially in individuals at high risk due to factors like smoking or a family history of the disease. Chest, shoulder, or back pain. Pain in the chest, shoulder, or back,
or more properly called edema. These swollen tissues can squeeze,
is another symptom that can be associated with lung cancer. This pain is not the typical ache or soreness that one might experience from muscular strain. It is persistent and may increase with deep breathing, coughing, or laughing. The pain can result from the growth of a tumor in the lung tissues or the lining around the lungs, known as the pleura.
So let's take a look at the general anatomy of the larynx as a whole.
It can also occur if the cancer has spread to the chest wall, ribs, or spine. A study published in the Journal of Pain and Symptom Management found that chest pain was among the most common symptoms reported by lung cancer patients, with a prevalence rate of about 25%.
Gastrointestinal, that is stomach, muscular, or psychological issues.
This pain can vary in intensity and character, and is often described as dull, aching, or sharp. It's crucial for individuals experiencing such symptoms, especially those with a history of smoking or exposure to lung carcinogens.
Over time, your body gets used to the good feelings from nicotine, and you can't do without it.
To seek medical attention. Early detection of lung cancer can significantly improve the effectiveness of treatment and can potentially increase survival rates. Bone pain and other symptoms. Bone pain, particularly in the back or other areas of the body, can be a sign of lung cancer that has metastasized to the bones. This bone pain is often worse at night and increases with movement. Alongside bone pain, other symptoms such as headaches, loss of appetite, facial swelling, and general weakness can also be indicative of lung cancer.
Vitamins, herbal remedies, or alternative medicines that can help prevent lung cancer.
These symptoms may occur due to the general effect of the cancer on the body's systems or specific organ involvement. For instance, headaches may develop if lung cancer spreads to the brain, while facial swelling can occur if lung tumors obstruct blood flow in the superior vena cava. A study in the journal Clinical Lung Cancer noted that these types of symptoms, while less common than others like cough or shortness of breath, are significant in the context of lung cancer, especially when they present without any other obvious cause. To recap, the early warning signs of lung cancer range from persistent coughs and voice changes to unexplained weight loss and bone pain. Recognizing these signs early can be crucial for timely intervention. Remember, awareness is key in the fight against lung cancer. Stay informed, stay vigilant,